Welcome back to In Doubt Checkout Dialogue with Dr. Nandini Mundkur, where we delve into many facets of childhood and their development. I'm Manju Bhargavi, the head of Sangamitra Early Learning and Sensory Integration Center, your host on this journey of understanding children. So please like, share, and subscribe to our channel and press the notification button for more updates. Any questions, please write to us on staff.sangamitra@gmail.com and we'll have your questions answered by our esteemed experts. To help us demystify autism, we have with us Dr. Nandini Mundkur, developmental pediatrician who has done pioneering work in the field of early detection and intervention services for developmental disorders for more than 3 decades now. She is the founder director of Center for Child Development with Disabilities and Sangamitra Early Learning and Sensory Integration Center, Bangalore. Dr. Nandini Mundkur co-founded Tots Guide, a comprehensive online self-educated portal aimed to cater to the vision of helping every child with disabilities to attain a better future. Doctor, I wholeheartedly welcome you for this podcast.
Thank you.
So today, let's understand more about the diagnostic criteria of autism, the different modes of intervention, and the support that these parents get. Doctor, what are the diagnostic criteria for autism?
Diagnosis of autism is made on clinical symptoms. There are no blood tests, no imaging techniques, no genetic testing available for us to do it and say this child is in the autism spectrum. Okay. However, once you suspect that during screening and other clinical signs the child has in impaired communication, stereotypical behaviors, then of course you can do an assessment called ADOS. ADOS stands for Autism Diagnostic Observation Schedule. This is a scale which is a gold standard for diagnosis of autism, available from infancy to adulthood. Now, but one has to be trained to do this ADOS to diagnose autism. Very few people are really trained in ADOS, and it's getting better, but it's very strict criteria for diagnosis of autism.
Okay.
There are some Indian tools also available like INCLIN and ESA, which is widely used, And also there is a tool CARS, that is Childhood Autism Rating Scale. That can also be used for diagnosis of autism. But most important is that we should be able to screen the children with MChat, which is available in several Indian languages. Again and again I'm saying this. As early as 18 months if you can do, you can suspect autism. And what is the current thinking is one doesn't have to really even wait for a diagnosis. If you feel this child has any deficit in any of the areas, please start intervention early.
Why should we assess these children early?
The assessment is done for us to understand how to understand and plan an effective intervention. Now, for example, the assessment tells us where is this child's deficit in different learning constructs. What are they? Like I say, receptive language. Receptive means what I understand in the language. Then expressive is what I say, which can be non-verbal and verbal. Then what are the imitation skills? The child uses imitation skills to learn. Where is this child in peer interaction with the other children? What is the intelligence level of this child? What is the fine motor skills of this child? These are all various learning constructs. We should have the level at which the child is. So that you can plan an intervention to take that child from that level to the next level. You see, development is sequential. I cannot be at 10 months level and do a task at 4-year level. The child is at 10 months level in functioning, say, in the receptive language. We can take it to 12 years, 14 months. Straight away, I cannot say I'll send it to school and the language will come. No. So that is why assessment tells us exactly where the child's level is in functioning in this learning construct. Further, child with autism may have sensory issues. And that hampers learning a lot. The child may have behavioral issues. That also hampers a child. So, assessment is to give a holistic picture of the child at the current level so that an effective intervention can be planned.
So, by assessing them early, don't you feel that we are unnecessarily pressurizing them into all these interventions which are called early? Or does it not traumatize parents or more stress children? So why again? I'm stressing. Why again the intervention has to start early? Why not at a later period of age?
See, the intervention early gives the best results because the brain of the child grows 80% by 2 years of age. Now, what do I mean by that? Do you know, you, me, a newborn baby, all of us have this 1 trillion nerve cells.
Wow.
But what happens between these cells is connection between them, happening at 100 million a second in the first 2 years of life. Every time I do this, you have made some 100 million connections, imagine, and you lose that. The power of this decreases. The brain doesn't say, wait, when you become 3 years, I'll start connecting. No. It says, my job is done. I've done my connections and I'm growing. So this is where the intervention helps us to build these connections. By 3 years, it is 80%. By 5 years, you're almost done till 90%. So if you lose this valuable time and waste it, how are you going to connect? That's not the only reason. The second thing which the brain does is it makes a random connections and we have to use it. Otherwise, there's something called pruning in the brain. That is, the connection will go away if you have not used it. So that is why to strengthen the connections, we have to use these connections. Now, how does a young child learn? It learns by looking at others. See, okay, before that, let me say something about the brain. See, we have something called the thinking brain, which is just behind our forehead. It's called the prefrontal cortex, which is like your CEO of the brain. It does time management, problem solving, critical thinking, anything in your conscious level which you're doing is done by this brain. The children do not have this prefrontal cortex developed like the adult.
Okay.
The child's brain is brain under construction. The prefrontal cortex starts to grow in the second half of 2 years or 3 years and goes till 22 years.
22 years.
Yes.
Okay.
So you can imagine there is no prefrontal cortex for the child to make all the decisions we are making. The adults are doing and the child is imitating and learning from us.
Okay.
Every child learns only by imitation and following what the adult does. So do that. What does the child need? It needs experience to see it, and then it needs practice. Experience and practice form the brain level to grow, and this is called the subconscious brain, or some people call it the unconscious brain, or not the thinking brain. So a child is programmed by the adult, I feel.
Yeah.
Because it learns from. So the more you give opportunity for the child to experience and do, the better is the brain construction. That is why you need an early diagnosis and an early intervention.
That's true. So the parents' role and the whole family's role, I think, play a major role in helping these children grow up on a.
Extremely crucial. Extremely crucial.
That's very interesting, and I think it must be challenging too for parents if they are not guided well, right?
Yeah.
Doctor, now that we understand that there is a lot of intervention, there's a lot of support that these children will need throughout their learning journey, we see a lot of behavioral changes in children. We see a lot of aggression when they go through a structured learning process. Now, how do you feel medications play a role on their learning? Do they really help, or there are many misconceptions saying that these medicines doesn't help them in their learning? They just succumb the child, they make the child very slumber, they make the child very low or very calm, or they are not participating. How do you feel medications play a role in their life?
Medications has a role when the child has behavioral problems, aggressions, irritation, lack of attention. These many of the children with autism also have attention deficit along with them. So medication helps them there. Or when they grow up a little bit more, they will develop a lot of psychiatric morbidity like anxiety, OCDs.
Okay.
So if the child is in that kind of a frame of mind, it's not going to learn. So a medication helps. But what is important to do before medication is behavioral management. Young children, we don't need medication, sorry. We need behavioral management. That is important for the child.
So I think behavioral management itself is a whole big topic.
It's every parent must have knowledge on behavioral management, I feel. It's so crucial for them to understand. It's easily manageable if you know, but you can even make it worse. We call it the parent cohesive circle. For example, the child is crying for attention and you give attention to the child. So what are we teaching the child? That, oh, I cry and my mother gives me attention. So it makes it louder. Then it cries and melts down. So we need to understand how to manage behavior. Now, child wants to escape from a task.
Yes.
And you say, okay, you leave the class. He is very happy to go because that's what he wants.
That's true.
A teacher should know that you can't do. This is called cohesive cycle. So understanding and managing behavior is very crucial for professionals as well as parents. It's a subject by itself and we have to dwell a full podcast on it some other time.
Sure. We'll have to catch up again, I think, because as I understand, behavioral intervention is a very big thing and it's a huge chapter by itself. So we will podcast the same at a later event. So coming back to the interventions that we are talking about now, there are many ways children are intervened. There are many therapies which are coming up now. What does these you were mentioning about these evidence based practices? What do they mean? Now, are there any research done on these, or are these methods researched and hence the intervention is given?
100%. Evidence-based practices means practices which show improvement all over the world. They're researched, they're published in research papers. Now, for autism, we have two main kind of research-based studies. One is called the ABA, or Applied Behavioral Analysis. This is perhaps the most exhaustive kind of training which is possible. And this shows good results, but you have to be a trained professional in ABA to use this technique. In the US, it's a 2-year course, a rigorous course only on ABA. We do not have such ABA qualified therapists in India in large numbers. There are far and few of them. Many of them learned little bit of... See, ABA uses lots of techniques which we use it in our other therapies also. Like, for example, reinforcement, prompting, modeling. These are all part of ABA therapy. So you pick up bits and pieces and say, I'm doing ABA. That's not correct. Let's give the ABA a good credit to say that it is very effective, but it has to be done that vigorously. But there's a caveat. In India, ABA is not very successful.
Oh, why is it so?
Because by a kind of culture we are in, we are not that kind of disciplined people to follow that technique.
Okay.
And secondly, there's a lot of family interference. The adults, why are you making the child do this? So I think any therapy should be woven in that culture. So we don't have that kind of support, and it's very expensive. Okay. In our countries which use ABA, the government pays for it. Our government doesn't pay for anything. The poor parents have to shell out that money, and so they give up very soon. So that is the ABA. The other one is called the developmental approach, which is the early start developmental model, which is practiced by many therapists, and it's quite good. It also uses certain techniques of the ABA, and it is effective. But what really fascinated me, and when we started the parent mediated center, and it was almost in 2015, almost at the same time, we put the parent mediated center. It is based on NDBI model. What is the NDBI model? It's a naturalistic, developmentally appropriate, changing the behavior with intervention.
Okay.
Now, this serves as a very good model for us because we have the child to work in the house. The parent works in the natural setting
Yeah.
of developing skills which the child wants at home, be it
True.
bathing, eating, interacting, and and you change the behavior in that setting, and we can train the parents on this to use this.
True.
And another very important factor I feel which is useful for our country is this uses the technique of what's called incidental learning.
Yes.
What is incidental learning is the child has an opportunity to learn because the NDBI model involves the child. It's a partnership between the child and the parent. It's not dictated by parents, do this, and that happens.
True.
It is child centered. And the parents learn to respect the child's feelings, understanding, capabilities, and then only without stress the child can do this. So incidental learning is, for example, child picks up a ball, you say, ball, throw, or if it's a big ball, red, green. So, you qualify and make it better and better, So the incidental learning is whatever the child does, we give a meaning to that and then we start with that as a child-centered approach. And this can be done by everybody else in the house too.
That's true.
So we have grandparents, extended families, everybody can participate in this to improve languages, to improve communication skills. And I think this model is very successful, which we have seen in our own center.
True.
That we have very effectively uses with the parents at Sangamitra.
Yes, that's true. So parents in this format of learning have tried to attach with their children, and we have seen a great improvement in the attachment and bonding that happens with children and the parent, and we have really seen good results when a parent is connected with a child and the learning is very smooth. It's a very smooth process.
Yeah, I think it also adds the child to be motivated.
True.
Because the parents are and generalization becomes easier because everybody in the family is participating. So it has multiple advantages, for using this NDBI model.
Yeah, that's great. It's I think even I feel the same. A child learning in a natural setting is always the best, rather than giving them a too structured or a very exclusive environment and then you help them to generalize. I think that takes a lot of time. So even I feel this is very great.